I think the first thing that care providers need to know about offering services in rural and remote regions is that there are a lot of smaller communities, a lot of shared services. So you may have an ultrasound appointment that's 2 to 4 hours away. Might mean somebody's taking a day off of work, navigating a city or a town they're not familiar with, could potentially be driving in -40 weathers in a blizzard to get to an appointment. So there are a lot of considerations that need to be looked at. People in rural and remote regions have an innate sense of strength and resiliency. They tend to really rally around one another. You might have to go to one center for an ultrasound and another center for a CT scan. So people are often helping out, navigating bus schedules or helping to book flights. Fortunately, some of the smaller appointments can be handled by telehealth or video conferences, but that might require going to the hospital to make use of a computer or having somebody help navigate those appointments. Have some flexibility because sometimes you are subject to traffic delays, flight delays, so it can be difficult to get there on time when you are reliant on public transportation to get there. It's important to do as much as you can locally. For example, my mother has rheumatoid arthritis. She doesn't need to go to Winnipeg to have her blood work done. She can have her blood work done in her local community and the results sent to the doctor. And that saves her a trip because if she's driving, that is 8 to 9 hours there without stopping for gas or food. The appointment itself, and then driving back. That's a 2-day appointment minimal. Healthcare practitioners can work alongside the personal team of the patient by stopping to have a conversation with them and understanding what their unique needs are. Not everybody is in the same position. Develop a more personal understanding of the patient before jumping into assumptions on what may or may not be possible for them. For example, it's very easy to say, you need to eat a more wholesome diet. A lot of the fruits and vegetables that are in use are going to be frozen or canned, or they're very expensive to buy in our community because they're being shipped in. A lot of diets are supplemented by living off the land, fish, deer, elk, moose. Maybe the access to foods is just it looks a little bit different. It's important to involve the local health care teams. Those are the people who are going to know those patients, the ones who have probably been there with that patient from the time that they have started their healthcare journey. A lot of emergencies require air travel. Can you imagine just going to the doctor for a medical appointment, finding out there's a problem, and suddenly you're whisked off and you are in an airplane? It's not a matter of asking a neighbor to just swing by and grab the things that you have forgotten. You have literally gotten into an airplane and have arrived in a major center that is several hundred kilometers away from your home. So anytime that you can, big changes like that from becoming emergent by being proactive and involving the local team, I think would only be beneficial to the patient.
The strength and resilience of those living in rural areas with dementia is something that I see close to every day. And when I especially go to those at their homes, you can see the support that they have from their caregivers as well as their family. And it's really important for many of them to stay in their home. They're more comfortable in their home. They have the support of their friends and family nearby, as well as they look for services that they can get in home, such as PSWs or nurses, so that they're able to stay at home longer. One day a week, I work out of a building where my clients come to see me. So they will either drive themselves or they will get transport to come. And then the other days of the week, I usually go out in the community to see them in their homes. In the winter time, if we ever had a snowstorm, a lot of the times they don't feel comfortable driving, or maybe the transport service says that they're not going to be driving that day. I say, okay, let's figure out a day soon that maybe I can come to you, or maybe we can reschedule you the following week. They often forget about their appointment. So just knowing that I give weekly reminders of any upcoming appointments And if I notice that they're 15 minutes late, I'll give them kind of a courtesy call to either check in on them, make sure everything's okay. I always kind of open in my schedule is to give a little bit of leeway for those forgotten appointments and try to work around their schedule. And I put myself in their shoes. This is their home. This is how they like their home. This is how they live. I need to respect that. And what can I do at this point to help them?